What is the condition of myocardial infarction? What are the causes and methods of treatment? Is it a serious condition? The most important information about this case is found in the following article. Myocardial infarction, heart attack. The most important information: heart attack. Myocardial infarction is a serious condition that may affect the heart. Let us know more about it below. What is the condition of myocardial infarction? Myocardial infarction is a condition that arises when a coronary artery has a sudden and complete blockage, or when blood flow in these arteries slows significantly. These blockages or slowdowns may occur as a result of several factors and things, such as a blood clot in these arteries or narrowing of the arteries from the inside because of atherosclerosis. Since the peripheral arteries mainly work to nourish the heart muscle, any narrowing or blockage in it may hinder the work of a particular region or several regions of the heart muscles, which may lead to a reduced ability of the heart to pump blood as usual, which of course leads to serious complications and damage that may it is always in the heart muscles. Hence, the origin of the name in English, myocardial infarction, means specifically the following. Meaning of syllable: myo, muscle. Meaning of syllable: cardial, my heart. Meaning of syllable: infarction, tissue death due to a lack of blood flowing into it. Causes of myocardial infarction and risk factors. Here is a list of reasons that may lead to myocardial infarction: coronary artery disease. Hypoxia or hypoxia. Use drugs or some toxic chemicals, such as cocaine. The following may also increase your chances of developing myocardial infarction. Smoking. Eat a high-fat diet. High levels of bad cholesterol in the body. Obesity. Stress and anxiety. High blood pressure. Age. Sex. Men are more susceptible to myocardial infarction than women. Menopause reaches. Although women are less likely to develop myocardial infarction, the chances of infection increase after menopause. Genetics and genetics. Quiet lifestyle does not include much movement. Having diabetes. Symptoms of myocardial infarction. Here is a list of the most important symptoms that may appear in a person with a myocardial infarction, the person who has a heart attack. Chest pain, where the patient feels a kind of tightness and pressure in the center of the chest. Feeling of dizziness or lightheadedness. Feeling sick or vomiting. Pain in different parts of the body, as if the pain gradually extends from the chest area towards the arms, especially the left arm, jaw and neck. Cold sweats. Cough. Difficulty breathing. Heart palpitations or arrhythmias. Feeling of indigestion, stomach fullness or heartburn. The symptoms that are apparent and the severity vary from person to person, depending on the damaged part of the heart muscle. Do the symptoms shown in women differ from the symptoms shown in men? Sometimes the answer may be yes. In addition to the aforementioned symptoms, here are some of the symptoms that may appear on a woman during a heart attack or that may appear on a woman in the period leading up to a heart attack. Pain in the shoulder or in the upper back. Unusual fatigue and tiredness for several days. Pain in the jaw. Dealing with myocardial infarction. The seriousness of this type of health problem lies in the fact that they often suddenly surprise the patient, and it must be done quickly to contain the situation for fear that the person may die or his heart will be permanently damaged. In some cases, the heart attack may affect the patient suddenly and without warning, and in other cases the patient may have early symptoms in the last hours, days or weeks prior to the occurrence of a heart attack, such as recurrent chest pain, the severity of which increases with movement and the severity of it decreases when sitting and taking a break. So if you feel the symptoms of myocardial infarction, you should act quickly and follow these steps. Call the ambulance immediately or call someone you know is nearby to take you to the hospital without delay. While waiting for ambulance, take any medications that your doctor has prescribed and recommend you to use them in such cases, such as aspirin, acetyl salicylic acid, knowing that this drug is not taken unless the doctor advised you because it is a drug that may interact negatively with other medicines. Or nitroglycerin, which is also a prescription-only drug. After arriving at the hospital, several medical procedures are taken depending on the patient's condition, such as coronary bypass surgery, catheters.